You're listening to Parent MD, the podcast where top pediatric experts do the homework for you, sharing clear and trustworthy medical advice so parents feel empowered to take the very best care of their kids. Welcome to Parent MD today, and we're glad to have our guest, Peter Lio from Chicago. Welcome, Peter.
Thank you so much for having me.
Thank you for joining us. So as we start today, we'll talk over the next few minutes. If we could, let's just start with, tell me about where you're from. Tell me about your education, background, your training, and your career path.
Well, thank you. Yes, I originally hail from the greater Chicagoland area, the northern suburbs of Chicago, and I grew up there and went to college at Northwestern University in Evanston, and then went to medical school in Boston at Harvard Med School. I stayed on to do my internship in pediatrics at Boston Children's Hospital, and then I did my derm residency at the Harvard Combined Residency Program. And then I stayed on as faculty for 3 years after that, and I was spending 2 days a week seeing adults and 2 days a week seeing kids at Beth Israel Hospital and at Boston Children's Hospital. That was an incredible time. And then my son was born, and we needed some family help, and my mom said, "We're not moving to Boston, so if you want help, you're coming back home." Exactly.
That's funny. I think most of us go where our spouses and family support for raising kids takes us, so not surprised. So you've been in Chicago ever since, correct?
Yes. Now I've been back in Chicago longer than I was away. I was in Boston 11 years, and I've been back home more than 12.
How much of your training was in the adult space versus peds, since you see a mix?
Mostly in dermatology residency, it really is adult focused, I would say. In fact, there is a formal pediatric dermatology fellowship program that came right when I was finishing. But I spent so much time seeing kids, and my continuity clinic was at Boston Children's that when it came time, my mentor, the great Steve Gellis, who's still practicing, still wonderful, he said, "I really need your help as seeing patients. So forget fellowship, just come start working."
So what percentage of your patients today are pediatrics?
I am about 50-50, to be honest, which I love. So I end up seeing a lot of families. Yeah. Interestingly, my practice is very different than a lot of other dermatologists doing general derm, because I see actually very little skin cancer now, very little much older patients, who have a lot of sun damage, and almost all kids and young adults.
Well, that's fun. In your career thus far, what have you seen to be the biggest thing that has changed since you've been out from when you trained? And what do you think the future holds for dermatology?
It's been an incredible roller coaster ride. So many things have changed. I think the openness to being more holistic, to thinking about integrative approaches has changed. It went from very skeptical and sort of a scientism approach where this is all a bunch of, baloney, frankly, to now much more interested and open. And in fact, we started last year our first cohort of what we call the Integrative Dermatology Certificate Program. And we thought maybe a few dermatologists would sign on, and over 20 dermatologists signed on to do a 9-month intensive dive into integrative derm. And we even have an integrative dermatology symposium. So I think that's been a huge change, all of this interest and excitement and great research. And the other piece, I think, has been really understanding some of the more nuances about the pathophysiology of diseases, especially atopic dermatitis. We are learning so much more that it's been an exponential amount of new knowledge. And I think we're starting to get closer to this precision or personalized medicine way that we've always dreamed of. Which leads into the next part of the question. Where do I think it's going? Yeah. I think it is going to the point where we're going to look back and say, gosh, we used to say evidence-based medicine was the best, but boy, were we wrong, right? It really is kind of a crude tool to look at a population and say, well, this worked a little bit better than the other thing for most of the people or some of the people. Like, that's not a good way to do this. It's certainly better than just anecdote or using the force or whatever. But really, we got to get to the point where we say, what is the underlying reason for this disease? What are the molecular markers that help us understand how we should treat it? And how can we fix the fundamental underlying problem? When we do that, and I often use strep throat as a great example, right? Strep throat has been around for a long time. We really get it. We get that it's the streptococcus bacteria. We have a great treatment. The treatment is so good, the antibiotic, if the patient doesn't get better, you'd say, did you really take it? Because it really just works. It should just work. Right. And that's how I want all diseases to feel, where there's really no wiggle room for trying to figure out why it didn't help you as much as the next person.
But that's a great point. From an evidence-based standpoint, we have practiced evidence-based, and we'll always use evidence, but the evidence has been based on populations, not the personal approach. So when you talk about the integrative approach to medicine and this concept when it comes to dermatology, how much of that could be, well, first tell me what you mean by that. I think I know what you mean. But how much of that also has to do with not just a holistic approach, but the emotional well-being of a patient, how it impacts dermatology?
Oh my goodness, right on. I think that's the secret really there, because to me, integrative dermatology can be defined as taking the best from different traditions and bringing them together in a cohesive plan for a patient. So it is this more holistic way. Maybe the patient says, I really would prefer to use more natural treatments. Maybe they would say, what kind of lifestyle things can I do to help this? As opposed to just writing a prescription, because the kind of running joke in dermatology is, everybody gets steroids. And the classic patient that comes to me says, the last 6 dermatologists all said, here's a 1 pound jar of triamcinolone with 11 refills. Right. Good luck. You're all set. And that's
smear it on.
Yeah, that's not enough.
Yeah.
So really trying to pull from these different traditions. And I think the secret, though, that if there's a hidden agenda to doing it, it is to really tap into the psyche as well. The way we talk about things in Western medicine, and particularly in dermatology, is often kind of belligerent or bellicose. It's like, oh, I'm going to suppress the immune system. We're going to cut this cancer right out. Right. We're going to crush this bacteria. But from an integrative approach, I think they use a very different language. They'll use things like, we're going to strengthen your skin barrier. We're going to tonify this. Who doesn't want to be tonified? Doesn't sound great?
Sounds great to me.
Right. Trying to bring these other concepts in. I think, and doing so, a big part of it really is the patient's excited again and they're hopeful again. And you need that to get better sometimes. You really do.
Yeah. I think for all of us who've been in medicine for decades now, you know that the holistic approach and the emotional well-being of the patient is so key in so many areas, not just how the immune system responds, but in the engagement, their ability to be compliant, their ability to listen clearly and be positive and get through the rough times and hang in there and be a good partner in crime. Now, that's just the partnership piece. But when it comes to, I think, the ability of the body's immune system to be all that it can be, I think it does take a positive mindset. I think obviously great nutrition. It takes that holistic approach. And you're right, it can't be just about putting cream on something, which is so much of what we've all been about in the past because we thought those were silver bullets. But there's so much underneath this. And we talked earlier in one of our previous conversations, I shared the story about one of my sons having eczema and how when he was highly stressed, the eczema got worse. And when he was around less stress, the eczema seemed to fade. And it wasn't correlating with, the creams necessarily. But it's multifaceted. It's what they eat. It's their stress. It's their immune system. It's their genetics. There's so much to it. And that's what's fun about medicine now is I think we're starting to pull it all together. And I think training's starting to go that way. So talk to us about the training the dermatologists are maybe having that's different today of how they look at the skin.
I think the dermatology training is notoriously pretty difficult, and it's this funny rude awakening after, medical school and usually an internship year in medicine or peds, or sometimes a transitional type year where you get to experience multiple things. Everyone kind of thinks it's going to be easy, and then you see your first few patients and you realize it is a fire hose of information. So it is very rigorous and difficult, but I think it is changing because I think we're trying to focus a little bit more on the patient experience and on communicating with the patient, because I think we all understand that if you can't get your message to them, we used to sort of celebrate the genius who maybe was also a jerk, right? Who would throw stuff and be mean because we'd say, oh, that person they sort of earn the right to be that way. But I think we don't agree with that as much anymore. It's like, you know what? You got to be nice. You got to be a good communicator.
Well, used to people said, well, if they're a great doctor, I don't care. But I think people realize today you can't be a great doctor if you're not a great person and a great bedside manner, communicator, inspirer, encourager, engager, because all that's just as important. If the patient's not engaged or compliant or gets the communication as a relationship, they're probably not going to do what they need to do because it's a two-way street. The doctor's providing a plan, but the patient has to follow through. And all that's got to connect. And I think those are places we've all had our eyes open in medicine. And definitely patients have been asking us to do that for decades. But I think we're finally coming to the table in the way that we need to.
I totally agree. So much of it is that relationship. And no matter how smart you are, the patient's smarter. They're going to change. Their disease is smarter. At least some of them are, right? These hard cases. So if you don't have that rapport, if you don't have that therapeutic alliance, I don't care how smart you are, you're not going to win those.
Yeah. What do you think is your biggest challenge, case, diagnosis that you see that you feel, let's just, instead of talking about all the great things, what's your biggest challenge? Where do you feel the weakest? Where do you feel that you don't have enough tools in the toolbox and you hope the future will change when it comes to dermatology? Which patients show up and it's going to be the hardest road for you and them?
It is one of my favorite questions because if you had a magic wand, what could you bring to it? Where are your pain points? And the truth is, there are so many. I think for me, it's still within atopic dermatitis. And despite all of these incredible advances in both understanding and new therapies, I still have a laundry list of unmet needs. We still need better treatments for itch. We still have skin pain in these patients that need help. We still need alternatives because, the joke is the patient didn't read the book or the disease didn't read the book. This is supposed to help. This helped 62% of the patients.
This should be gone.
Exactly.
And it's not.
And now, that's a real patient with a real problem that you have to help. And sometimes that's where evidence base dries up. There's nothing past this. So that's when you have to get creative. And so I really feel like that is a disease state that causes just untold suffering for patients and families.
Yeah, we've talked a lot about eczema lately with the toolkit that you're helping us put together, and appreciate your time on helping get the acne toolkit together as well. Two diseases that definitely challenge kids and parents all the same. And again, it's like you said, we're trained to identify what's going to take care of it most of the time, but every patient's different. And we all learn through our career how to take care of those patients better. But I liked what you said earlier about the parent and empowering them and knowing that we have to listen to them because sometimes they have the answers. And not sometimes, many times they have the answers. Often they have the answers before they come see you, but sometimes they solve the riddles when we can't, because hey, when we do this, this makes it better. When we do this, it makes it worse. And like we also talked earlier, another conversation, that's why it's so key as a physician to know what they've tried, what makes it worse, what makes it better. So when they come see you, you want them to have that list and those questions already down, right?
100%. I learn from my patients every single day, no doubt about it.
With all of that being said, what is the top advice that you would give to parents who are struggling with things like eczema and acne right now? What's your best advice? And then what's your best advice that you would give the doctors who are taking care of them in their medical homes while they're working with you or before they come see you?
I think for the parents and families, it's really don't give up. Keep searching because sometimes I really will meet people who after 5 and 6 different doctors still, they've almost given up faith, but then they still find some relief and they find some answers that they're looking for. So don't give up. And I also think that it's worth thinking about it from different perspectives. If you feel like everyone's telling you the same thing, it can be worth sometimes going for a different perspective or a different opinion just to get a new, fresh insight. For the providers, the physicians and nurse practitioners and physician assistants who are taking care of patients outside of dermatology, I think my advice is to keep on learning and keep reaching out and knowing that there's no such thing as a stupid consult. There's no such thing as a dumb question because I'm still learning. There's even in my little teeny tiny corner of dermatology where I know an awful lot, there's still an infinite amount of things I don't know. Right. So there's no dumb question. And if you're doing other things, it's hard to keep up on all these different areas.
Yeah. The question I meant to ask you earlier, but I think with our conversation, it becomes a little more clear anyway, and one could read in between the lines. But why is it you like dermatology? What prompted you to go down that path to begin with?
I really thought I was going to be a neurologist because my background was in neuroscience and in particular learning and memory systems. But when I did my neurology rotation, I have to be very frank, it was depressing. We saw all these patients with very interesting conditions, but we could do very little to help them. And I was kind of down after that. And then I did my dermatology rotation, and it was the polar opposite. It was all about therapy. We had everything from creams and lotions to shots to pills to lasers to using ultraviolet light, even temperature. We have things where we freeze things, we can heat things, we have all this stuff. And I thought, this is what I'm interested in. I want to be a therapeutician. I want to understand how I can maximize these treatments and help people. And that really inspired me and started my fire. And I trained under some of the most incredible mentors who were just so creative and clever and listened to their patients and met their needs and thought outside of the box. And that's when I decided this is kind of what I want to do the whole time.
Interesting. So along with your other areas of interest, you mentioned that you have a podcast. Tell us a little bit about that because it's a little different.
I have a really wonderful friend who we've honestly been friends since kindergarten, if you can believe it. Our whole lives were basically family. And we grew up together and loved video games and loved movies and all this kind of stuff and music from the 80s. And we decided to make a fun little side project. It was kind of our pandemic project where every couple of weeks, we get together and we talk about one of our favorite shows, movies, technology, soundtracks from the 80s. And it's called McQuaid Arcade. And it is really fun. And we laugh the entire time. And if we get some unwitting people to listen to it, usually they like it too. It's actually kind of fun.
Well, that's great. So you definitely do other things outside of dermatology.
I sure do.
That's awesome. Well, we appreciate you being with us today, and definitely want to thank you for your time and helping us put together the toolkit with Parent MD around eczema and acne. I know these will be great resources for parents and pediatricians, and appreciate your time and collaboration partnership.
Oh, it's such a pleasure, and I really do hope that these help patients and families.
Definitely. Well, thank you, Peter.
Thank you.
You've been listening to Parent MD, the podcast where top pediatric experts do the homework for you, sharing clear and trustworthy medical advice so parents feel empowered to take the very best care of their kids. If you enjoyed today's episode, go ahead and click on that follow button on your favorite podcast app. It's the best way to make sure you never miss a single episode. And while you're at it, why not leave a 5-star rating and comment as well? We'd love to hear your feedback, and it helps other parents find the show. The Parent MD podcast is a part of Parent MD, a new way for pediatricians to help parents. Parent MD is an online source of parent information you can trust, straight from board-certified pediatricians. For more information about Parent MD, visit us at our website, www.parentmd.com. That's it for this episode, but we will be back soon to tackle another topic to help parents make confident and informed decisions about their children's health.